Sometimes you're not taking magnesium and you actually do need it. Remembering that when we're looking inside a hair test, this is unique to you, finding your own symptom pattern. And what it's looking at is inside your cells. What is your unique pattern? And this pattern is made up of one, yes, what are you consuming? So what minerals and substances are you consuming inside your food, inside your environment, also inside supplements? But then also, what is your body deeming it needs to do with those substances to maintain balance? Because we always store and move minerals between different tissues. Calcium, for instance, is stored in our bone, but we also need it to move into different tissues to send nerve impulses, to contract and relax muscles like our heart, like our gut. We need different minerals to be stored and also moving. So this is where it's not just about having a blood test. We actually need to look at what's happening inside the cells, which is by looking at a hair test, to then really understand the complete picture of what is your body trying to do? And this is where it gets really cool, because our symptoms become the answer because we're listening to them differently. So with this patient, you can tell she's a 30-year-old female, and this patient isn't taking magnesium, but she actually requires it. So again, when we're looking at these ratios and these levels, we want ideally them to be in the ideal reference range. And this is where the white shaded bit of each box is. So we can see that her magnesium is slightly lower. Most of her levels, in fact, are lower, besides her phosphorus level. And what you can't see here is that her hair sample that she sent was a pubic hair sample, which is an option for everyone. But when a pubic hair sample is sent in, what can happen is the phosphorus level is higher in pubic hair, because it can be from soap residue, and it can also be other factors. So it's not as reliable for a systemic picture when we're looking particularly at the phosphorus. So we're going to reduce that mentally slightly in our mind here to see the overall pattern. But what we can see is that her metabolism is working overtime. It's fast. So when we assess what's happening, we can see that her metabolic rate has increased. She's actually using a lot of her minerals. In her specific history, what we found was she was actually under eating. So there was two factors happening. She was in an acute phase of stress, so her body was actually demanding a lot of resources, so it was using it in her bloodstream. And then also, she wasn't consuming enough resources. Now, this patient was experiencing symptoms of period pain, debilitating period pain, and also noticing that she had a lot of fatigue. And prior to getting her results back, she actually started to increase the amount of food that she was having, and she already started to get much more energy. We can see here that her stress response was actually elevated, and also her minerals were just low in general. So by changing her lifestyle, yes, that's incredibly important. And we need to look at the nutrient fundamental in terms of, well, what are you actually eating and exposing yourself to? And then we can also look at what's the underlying pattern underneath. And that's really where we always consider all four of your fundamentals, which is, yes, your nutrients, which includes what you're eating, what is in your environment, like heavy metals, also xenoestrogens, but also what supplements you might be taking that are making you worse or can make you better. Then we're looking at your nervous system, your metabolism, and blood sugars, and they all impact each other. When our nervous system is heightened, in an acute response, our body will use a lot of nutrients. If it's been heightened for such a long time, our body will shift gears and conserve. So our sedative minerals go up and our excitatory minerals go down, because our body's trying to maintain balance. But what we can see here is her adrenal function is starting to fatigue here. And we can also see that her ability to cope is okay at the moment, but based on all of the other trends, this is the trend that it's starting to go down. And you can see here that some of the recommendations for her were that magnesium. So we also see that there's recommendations to help support the underlying nervous system trigger that's actually demanding a lot of that magnesium from her body too. So it's always important to be looking at the overall picture, not just supplementing with one thing and hoping that fixes everything. We need to address what the underlying overall pattern is inside your cells, which is about looking at all four of the fundamentals that are unique to you and giving you exactly what your body is calling for.